Okay, so welcome back to the second week of our virtual course. We hope that you enjoyed and learned something from our first session, and today we're really excited to speak with you about healthcare communication. So today I'm joining you from the ancestral traditional territory of the Mississaugas of the New Credit. So in the colonial records, this land has been described as the council grounds of the Mississaugas of the New Credit. This preferred location really allowed for camping for the hundreds of Mississaugas who traveled by canoe to conduct the governance of their nation, to trade and engage in negotiations for treaty making and land transactions. And the Mississaugas lived lightly on the lands they occupied and purposefully moved about the landscape, harvesting resources as they became available. So as an invited guest on this land, I have the pleasure of living, working, and playing on this beautiful territory. And I'm thankful for the Mississauga people who have cared for and continue to care for these lands. I recognize that people here today are joining from near and far. And I also want to acknowledge the elders, the caretakers, and owners of the territories from where you may be joining us today. So again, please let us know if there's a land acknowledgement you would like to share, or if you would like to lead the land acknowledgement at the start of one of our sessions.
Okay, maybe what we'll do is we can also introduce our speakers who are going to be involved for today. So Irfan, I wonder if you can introduce yourself because you're new to the CAMH team and you're going to be speaking today. Do you want to say hello?
Sure. So hi, everybody. My name is Irfan Jiwa. I am a physician and research analyst working at the Azrieli Center with Yona, Joanna, Tiz, and Katie, helping out with this program. I'm also a sibling of a 16-year-old boy. And very happy to be here to share some learnings with you.
Thanks, Irfan.
Okay, welcome everybody. So Irfan already introduced himself, which is great. We're really excited to have him here today with us. And Lee and Yona will be presenting as well, who you met last week. So last week we talked about the HELP model. So if people remember, that was where we really sort of take a holistic view of a person's well-being and sort of make sure to consider their health, their environment, their lived experience, and their mental health. And so today we're focused around how to improve communication with your loved one's healthcare providers. So whether that's a family doctor, social worker, psychiatrist, a nurse, an occupational therapist, any kind of healthcare provider, and how we can really empower our loved one's voice around that communication. So in doing that, today we're going to be sharing some tools and resources to sort of help facilitate healthcare communication. And we'll also talk about ways to prepare for hospitalization, whether that's for you or your loved one in the current context of COVID. Okay, so if we go to our next slide, I will turn things over to Yona.
Thanks, Joanna. So I'm going to talk for a little bit, then we're going to break out and talk in smaller groups, and then we'll come back to the big group again. I'm highlighting here two reports that were written before COVID. These are reports looking at the whole population of adults with developmental disabilities here in Ontario, where I'm from. And what's important in these reports, and we can put the links in after, are the numerous health issues experienced by people with developmental disabilities when we can compare them to the rest of the population. So if we go to the next slide, this is our 2019 report that we published exactly about 2 years ago from about now. 5 concerning healthcare issues that happen to people with developmental disabilities. I'm going to explain them, and I want you to think about how that impacts people during COVID. So the first thing we looked at is how likely people were to go to the emergency department, then go home, and then get back to the emergency department within the month. And we saw that people with developmental disabilities across Ontario were almost 2 times as likely to have that happen, okay, over 6 years. We looked at how likely it was that someone with a developmental disability would be hospitalized for something and then discharged and sent home, but come back and get rehospitalized again within that month. And we saw that it was 3 times more likely for people with developmental disabilities. We also looked at something called alternate level of care. And that's basically when you're in the hospital and you're ready to go home but you can't go home because there's nowhere for you to go that's sort of safe and supported enough for you. So you're stuck in hospital. Sometimes we call that being a bed blocker. But the point is, it's a very stressful time because other people want to be using that hospital bed. You don't want to be in the hospital, but you can't get the support you need elsewhere. And we see this is almost 7 times as likely for people with developmental disabilities. Now, long-term care use, and we've heard a lot about long-term care during the pandemic, is not a very common thing to happen for people before they hit much older age. But for people with developmental disabilities at a younger age, they are much more likely to be living in long-term care than adults of the same age, younger age. And finally, and here's the one I look to a lot and I try to tell decision makers about, is that dying before the age of 75, which is what we call premature mortality, is almost 4 times as common for people with developmental disabilities. So we looked at adults over a 6-year period, and we saw that the general population, about 1.6% of them died in that period, whereas 6% of people with developmental disabilities died over that period of time. So this is a very complex group of people in terms of both their healthcare needs and maybe how well able we are to give them what they need in terms of healthcare when they need it. That's what this visual sort of tells me. And that has really important implications during the pandemic when healthcare is even more complicated to access. So if we go to the next slide, we have a little bit of a thinking assignment for you. We want you to think about a time where you took your loved one to a healthcare provider and it went really well. What was it about that time that made a difference? And we want to know, what were the things in place? It might have been things you did, things that your loved one did, things that they did in the healthcare environment that made it go well. So you can introduce yourselves to each other in the breakout room. You'll have a few minutes and we want to exchange stories focusing on that essence of what made that a good visit. And we want to actually sort of collect that information from everybody after, because there might be some important hints and things we can all learn.
Welcome back, everybody. We hope you enjoyed the breakout.
Okay, so while people are pasting their ideas in from their groups, which is great, I think we'll go back to the teaching part of things. I'm going to say a few more words and then I'm going to turn things over to my colleague, Irfan. So here's some pictures of beautiful, happy pre-COVID healthcare. These are actually, you'll be meeting one of the folks in these pictures is Bill Sullivan, and he'll be doing one of our sessions in a couple of weeks. Another one is a fabulous nurse, Angie Gonzalez, also from Ontario. And then there's 3 actors with developmental disabilities who are helping us to film some sort of teaching, sort of pictures and videos around healthcare. And if you watch some of these videos, you will see things happen that I'm sure have happened to you in healthcare. And if you haven't, you're very lucky. So one is in the top picture with the blood pressure cuff, the doctor who is basically talking almost entirely to the sister and ignoring the person in the chair there and not really preparing him for things like the blood pressure cuff. And it's making this man quite anxious. And then in the picture on the bottom, we've got this guy who's coming to the emerge because he's distressed. And you'll catch Angie doing an eye roll, off camera because he's back again. This guy just keeps showing up. Why is that? What are we supposed to do? And sort of how we might deal with that. So there are a lot of complexities when it comes to healthcare. Not everyone has a good experience. And I think all of that gets amplified during the pandemic when it's harder for us to access healthcare. So what we wanted to do today is talk a bit about ways to improve healthcare communication and preparation, because I think that can make a really big difference. So if we go to the next slide, I'm going to talk about overall why healthcare communication tools can make a difference. And then Irfan's going to go into some more details on some tools we developed together with people with disabilities, with families, and with staff. So what we really want in healthcare, regardless of how many words our loved one can say, or speak, I should say, because some people can say a lot, they just don't speak. Tools help them amplify their own perspective or experience or voice, so that the focus really can be as much on them as they're comfortable with. And it also gives hints so that things that can make that healthcare visit go better are like right there in a really obvious way for the healthcare provider, so they can try to put those things into practice. It's also really helpful to have these tools because we need that record of all the healthcare that happens. And I think we sometimes can assume, like, if I'm seeing my doctor, they must know everything. They must know about all the visits. But the truth is we do not have a very good electronic medical record system, and they don't know everything. And even if they have all that information, they don't necessarily have the time to read it. So we need to have our own information. And I think using these kinds of tools helps us hold our own record, which helps us stay organized on the whole healthcare experience or the healthcare story. And also, it allows for consistency. So certain things happen one way with your family doctor, but it might be different if you see a gastroenterologist or a psychiatrist. This is one way to give everyone the same information, so they're all on the same page. This is just an example of a website that we've put together with a lot of resources. It was done before COVID, but still relevant during COVID, to help you with healthcare navigation generally and to help you with healthcare communication. And the tools we're talking about today, you can also access through this Family Matters Toolkit. And I think, Irfan, it is over to you.
Thanks, Yona. So yeah, just like you were saying, our tools are available on that website, which has a toolkit. So there's these two communication tools as well as a variety of other tools. But I want to sort of preface and say that tools are meant to help communication. It's not necessarily about using these specific tools, but using tools as a way to improve the healthcare experience for everybody involved, including your loved ones with disabilities, yourselves, the physician, everybody at play. So use these tools sort of to inspire how you prepare for your visits in healthcare. And we'll talk about the specifics about the two tools that we're going to talk about. So the first tool that we have here is called About My Health. This is meant to be sort of an overall record of someone's health. It has a bit of demographic information, some information about important contacts and important people to the person who's being cared for. And then, like we were talking about earlier, some strategies around communication that really work, because we know that not everybody communicates the same way. There's certain strategies that work better. So there's some suggested strategies in there, as well as space to add your own. There's strategies around communicating and helping out with difficult procedures like doing blood work or having any injections. Very important as we talk more about the vaccines coming along. And then there's also a section talking about how, where you can note down how your loved one expresses different emotions. So things like feeling scared, being in pain, being nervous, all those things are captured on the second page of the form. So yeah, so within the About My Health form, those different pieces are captured and there's a space for you to fill those out. Now these forms are available as PDFs online, so you can fill them out on your computer or you could print them out and fill them out by hand. And the way that we suggest using this tool is every time you're going to see a new provider, this will give you a snapshot of who your loved one is that you can take when you're seeing that provider for the first time. So let's say your family doctor is referring you to a specialist, you take this with you when you're going for that first time specialist appointment. So that's where you'd ideally be using the About My Health tool. We suggest updating it on a yearly basis so that all the information within there is up to date, because there'll be things like your medical diagnosis, what medications your loved one is taking, your allergies, that sort of thing. So a good exercise to review this tool and update on a yearly basis. I'm now going to invite Lee to talk a little bit about her experiences using the tool with her loved one.
Thanks, Irfan. You know, it seems like a straightforward tool when you just look at it like this, but what I found was that when I did complete this with my son, just how great an opportunity it was to have conversations that I might not have had otherwise. And they were, you know, the conversations were able to be done while we were both calm. When, you know, to have this ready, and the other tools we're going to talk about today, having these tools ready ahead of time is so much better, because there's no threat. You know, you're not trying to deal with it when you're already upset or worried. And so, yeah, I just found that it was a great opportunity for us to have conversations, things like things I like at a healthcare visit, things I don't like at a healthcare visit, just in a way to empower my son's own way of communicating. You know, what do I do when I feel scared or nervous or in pain, or, you know, how does that show up? Maybe like sometimes with my son, he'd laugh when he's afraid, but that might be misunderstood. So I guess the biggest takeaway for me about when we did this forum together was just how helpful it was to have the conversation while we were both calm and non-threatening. And there were answers that I would have thought I knew, but when we got talking about them, new points really came up in completing this forum together.
Thanks for sharing that, Lee. And yeah, like it's an interesting exercise to go through this when you're calm, is what I'm hearing from you. But so important to sort of prepare ahead of time for those healthcare visits, because we know that healthcare visits, there's never enough time to do everything that we want to do, from the provider's end, as well as the patient and loved one's end. So being prepared and being set up really well ahead of time goes. And yeah, doing those things, because when we're in the office, a lot of times we've heard from some of the people I work with through the research center, they were telling me that, like, yeah, sometimes we're in the doctor's office, we're nervous, we forget to say the things that we wanted to say, we're anxious, sometimes we have issues with getting the right words out. So doing some of this prep work ahead of time really helps to set up for a really good visit where you get to all the things that you need to do. And I recognize that some of you may already have certain systems in place where you're doing some sort of note-taking and some prep work ahead of time. Because as parents, you guys are super resourceful, and having worked with a bunch of you, have noticed that, like, yes, parents are doing things to support healthcare visits. So these tools, I would say, would be inspire you to think about what are the different sections that maybe you haven't quite thought of that would also be helpful in preparing for your doctor's visits. And then if we go to the next slide, I'll talk about the second tool, which is the My Healthcare Visit tool. So this tool has two sides. One is before the visit, and then the second side is during and after the visit. So this tool really captures the essence of why are you going for this appointment? What is the reason behind going in for a visit today? Is it because there's a stomach issue that's been going on? Is it a mental health concern that has come up recently? Is it a medication review? So trying to give you some space there at the bottom of the tool, as you can see on this slide, is talking about why are we going to see the visit. So this is a tool that you would use every time you go in for a visit, whether it's your family doctor, whether it's a specialist visit, whether it's the emergency room, just to help you gather your thoughts and figure out what exactly is the purpose of this visit. What do I want to achieve? It's almost like, okay, like what are the things that I want to make sure happen at today's visit, and help you focus along that way. So if we go to the next slide, I think that's the second part of that form. And this will be filled out during the visit, where there's a bit of a summary on what exactly was discussed between you, your loved one, and the healthcare provider, and then what are next steps. So what is the plan given the discussion that has just taken place? Do we need to do some blood work? Is there some new images or other tests that need to be done? Is there a referral needed to a different provider or a different doctor? Or what changes need to be made at home? And then there's a specific section, as you can see on the bottom there, talking about medication, because a lot of times that will be a change, either a change in your medication dose or if new medications are being added. So a space to record that as well. And then there's also a section right at the bottom of this page, I don't think it's in the screenshot here, talking about what worked well at the visit and what didn't work well. So a bit of a space for reflection to say, okay, did that go really well, or is there something that we can do better? So that's generally the My Healthcare Visit tool. Okay, yeah, we do have the slide up, sorry about that. So at the bottom there is where we have the comment section, where that's where you can do some of that reflection. So this is a tool, like I was saying, to take to every healthcare visit. It helps you to focus your visit and prep for that visit ahead of time. And like I was saying, like time is of the essence when we're in healthcare appointments. We know doctors and other health providers are super busy, but this is a way to do some of that prep work and get things ready as well as possible ahead of time. So Lee, any experiences you want to share on the second tool?
Thanks, Irfan. You know, I really enjoyed getting ready for this session because you are a doctor, and we had some conversation around this. You know, as a doctor, how helpful would you find these forms to be? Because as you said, time is sort of the essence. I think what stood out for me about both of these forms, and especially this one that you're talking about, is, you know, it helped us stay on track during the appointment because, you know, a certain question that the doctor might ask my son might get us going on a totally different tangent than the reason that we were there for. So it helped us sort of stay on track. It helped the doctor stay on track. It was right there, a reminder of medication. It's captured there. And the issues and the reason that we're there, you know, whether it's focusing on pain or, you know, we may be talking about my son's medical condition of diabetes, but, you know, I might have forgotten to mention sleep, the sleep issues, or the fact that, you know, diet. So when we think about that help model last week, it really helps me think about all of the sort of health reasons that I want to help make sure get covered. And so when we were doing, again, doing this together, it was very helpful to talk about what happened during the visit, and also gave us a chance to debrief after the visit. You know, what worked for you? You know, what do we want to make sure? Did we miss anything? Do we need to follow up? And you know, when we were talking just before we started, you know, in our little breakout session, you know, one of our caregivers was sharing just the importance of having the staff know our child or extra time for visits. That may not always be the case, but here's this written record now that I can leave with the doctor and keep up, you know, keep updated. It's a written record for the doctor, the dentist, or whatever healthcare provider, but it's also a summary for me and my loved one when we get home about that visit, because after a while, I just don't remember that well. So here it is written in a written form.
Right. I mean, even as a doctor, like you see so many patients in a day, you trust your records to do a lot of the remembering for you. So these tools would serve as records for patients and your loved ones to form that your own personal health record at that point. And yeah, I think I can touch base a little bit on what it would be like for me as a physician to be receiving these tools. So a lot of the times, if you know, whenever you're going to see a specialist, your doctor, your family doctor will send them a bit of information about the patient or about you to the specialist. I almost see like the About My Health form as a referral form, but this time coming from the patient and the family about this is who I am, and this is how is the best way that you can take care of me. These are my specific needs, and this is how I would like to be helped. And this is what I like about healthcare, and this is what I don't like about healthcare. So all that information, having that before an appointment can really help me get in the right mindset of, okay, this is going to be my game plan of how we're going to use the next 15 minutes in the most efficient way possible. I need to cover and make sure that I don't forget, and make sure that all these concerns are addressed. So like we were saying, it really helps to focus the visit and make sure that all those accommodations, if they need to be prepared ahead of time, there's some time to get those things set up and ready to go. And then during the visit, we're really like focusing on the concerns that are being raised. Like you were saying, right? If you set up those questions ahead of time, they're like, okay, these are the things we're going to talk about. If the doctor knows that these are the things you're going to talk about, you and your loved one also know what are the things you're going to talk about. It's like having this meeting agenda where everybody comes together and they know exactly what needs to be done. So a little bit of prep work goes a long way. I think that's my biggest takeaway. I think we can go to the next slide. And yeah, we wanted to have some space for you guys to ask your questions. So feel free to enter those in the chat box. We can answer those questions.
I just saw a question come in about if your loved one lives in a group home or supportive environment. Can we ask direct support staff to fill these out? Are these commonly used?
So when we were developing these tools, we actually developed it in conjunction with one of the organizations that runs several group homes. And we piloted an earlier version of these tools in the same sort of group homes and community settings. So these are definitely being used in group homes. I think that group homes also have some of their own versions of these tools when they're having healthcare visits, and they have their own records. So I do understand that there might be some pushback saying, we're already doing this form. We have this similar form that we're
I think Irfan just froze. It's kind of like playing a game where we see who's going to freeze next. So I'm not frozen, I don't think. I think you guys can see me. Yes, Irfan,
Being
it's
filled
true.
in.
We lost you for a little bit, Irfan. I'm just going to add a bit more to what you were saying before you froze,
Sure.
which is that sometimes what we've seen is absolutely a lot of residential settings have kind of rules around whenever they go to the doctor, they get forms filled out. And that's actually why we started with this form, because we realized, the forms that healthcare providers have and the forms that agencies have, they forget about the person who's going to the visit, right? Like it's almost this pure interaction between the agency gives the form to the doctor fills stuff out, and then it goes into some file somewhere in the agency. But it's not, it's an opportunity to be communication, right? Where the patient is at the center. And the existing tools
Right.
don't really allow for that. So that's why we kind of tried to shift the focus, but changing is hard, right? So sometimes I think it might be an agency who's kind of reluctant to use a different kind of form because they already have a form that's mandatory, right? Or the doctor says, I don't have time, so I already filled out another kind of form, I don't want to do that form. So it's sort of how do we gently help people move? And I think when people appreciate why it makes a difference, there can be some movement. And yeah, so I think you're certainly welcome to reach out to us. We've been studying this for some time. We've developed some strategies, and also in the toolkit you'll see some hints on how to use the forms. I noticed a question in the chat box around what happens when you go to the emergency department. And just to make a little comment about that, we're going to talk about the emergency department in a little bit. But sometimes I say we have different versions. If you have to read Romeo and Juliet in high school, you've got like the fancy Shakespearean version that's like from 200 years ago. You've got the Coles notes is what we used to call it, but now there's no such thing as Coles. It's probably like the Google notes or something like that. You've got the Romeo and Juliet like sort of infographic thing. You've got the YouTube version. And it's the same with our healthcare information. So you might have a really thick binder with tons of information about your loved one. And you might have this about me or about my health, today's healthcare visit. You might have a one pager. You might have a medical alert bracelet that just has one or two words on it, and then you can call medical alert and get more information. You need to know when you're going somewhere how they like their information packaged. Do they want the full Romeo and Juliet original Shakespearean version, or do they need the Coles notes, right? So different settings like their information sometimes in different ways. But I would say, and I've studied and worked with emergency departments for many years, that when they have the right information presented in a way that they understand, it can be quite helpful. So just because you've had an experience where maybe people didn't look at stuff as much as they could have, don't let that discourage you from ever giving information, because information is power, and having more information can really make a difference.
Yeah, definitely agreed with that 110%. Like even having done some experiences working in the emergency room, I think whenever patients were able to give me some information that I could take away and just like extract what I need from it. So even if I don't look at the entire tool, let's say if we're talking about my health, even if I'm able to see your entire sort of med list or your entire sort of allergy list right there, I think it would be really helpful, like because physicians will tend to know where to find exactly what they want within that tool. They won't look at it for very long or to have the whole, maybe take away everything that you've put in the tool. But even if that one section is filled out very accurately, I think it can be really, really helpful as information.
Maybe the other piece to add to that is that when everyone has their own version of the tool, in the emergency department in one city, they have to get used to so many different kinds of things. I think that's what stresses them out sometimes. But if you can have some consistency with your local emergency department around how you're presenting information, it's just going to get easier for them to use that, right? So kind of leveraging or building off of models and things that they're already doing can be really helpful.
Can I just also make just a quick note that I noticed in the chat function how people were sharing that they really liked it when the doctor was speaking to our loved one, not as if they were just, what you said earlier about the videos, Yona. And I think doing this tool ahead of time tells our loved one that they're an integral part of this conversation, because you've had this conversation ahead of time, and you can review it before the appointment as well. Remember, today we're going about this particular issue to the emergency or to the family doctor. So it puts their care back into their own ability to communicate, whatever that looks like. They don't have to be verbal in order to have ways of communicating. And when we say we want to empower our loved one's voice, that doesn't mean voice as in I need to be able to speak. for me, these forms are a way of communicate. It's a communication tool that allows, going back to last week's help model, it captures the health part. It also captures, it's a chance to talk about lived experience. What triggered the past? Remember, we talked about how environment and lived experience has that cascading effect. So, you know, and that it's never just about this one moment. It might be triggering a bunch of moments. So this is a really wonderful way of capsulizing for me and my loved one what it is that I'm doing in this particular appointment, and then giving them a chance to debrief afterwards. So those are just a couple of things that I thought of as you were talking about. It's great for the doctor, but it's great for us too.
And yeah, I mean, sometimes there'll be doctors who will push back and be like, "I yet another form, like get this away from me, I don't want it." Or you're facing a lot of resistance. But coming back to what Lee was saying, I think even if the doctors are not that keen on using it, I think the prep work that you're doing by filling out that form, that will serve you well in terms of having your loved one's voice really captured within that preparation of like, okay, why are we going to the visit? Because sometimes some communication styles do take longer to communicate the same message. But if you've had that done ahead of time, again, you can very quickly transmit that information. So there's a lot of, I think, benefits that we've seen with the tool, and some great things we've heard from even some self-advocates, so people with intellectual disabilities who use the tool, and told us that, like, yeah, it really helped them to focus in on their visits and figure out what they want to say, make sure that they're not missing things.
Maybe the last comment I'll add, and I think we'll move on to talk more about COVID-related tools after that, is I see the comment here about having something that's more of an EMR that's just sort of there for everyone. It shows up on the screen. We'll try to send a link maybe for next week. We've been working on this form that we've been talking about is a PDF, which means you can open it up and type into it and save it and print it or send it to someone. And then you could also update it over time. But we've been working with one of the EMR or electronic medical record providers to make a version that you'd kind of like fill out on a tablet or something, and Zoom, it would go right into the patient's medical chart. So that exists, but it's only with certain electronic medical records that it works. But if anyone is interested in that and wants to hear more about it, we're sort of trying to test that out and see how it works as a vehicle. And there may be other tools that are not designed necessarily for this population, but still do some of the same things. And those can be useful too. We just thought it would be helpful to try to think about some of the key issues that are important for this group as a kind of reminder and way to make things a bit easier. All right. So one of the things we started to think about during the pandemic, when we realized how different healthcare was looking, was that we needed to think about what information is most important now. So we were, if you can imagine, and I don't know which of you have had experiences with COVID, especially in the spring when it started, but you know, if someone was going to the hospital, they were in pretty bad shape with COVID, right? And there were a lot of issues around whether caregivers, family caregivers, could actually go into the hospital and support their loved one. And I know this is still a fear for hospitals. Most jurisdictions are recognizing the importance of a family presence for people with developmental disabilities. And we can also maybe include in our resources tomorrow some sort of Canadian sort of documents explaining why this is so important. But we wanted to think about what information do people need up front, especially if that family member wasn't allowed to come in right away, or if people were looking at a form and not having a conversation with the person, what they really needed to know. And so we worked together with a family physician who was involved with a very large outbreak that took place in Toronto with people with developmental disabilities, and with an anesthesiologist who was working in the hospital. So we got a couple of people working with people with developmental disabilities in hospital settings, as well as community care. And then we got input from families and people with disabilities, and we came up with another tool. So I think we'll share some slides sort of showing that tool next. So this is the reality. The reality slide reminds me to tell you about the reality, which is that people are afraid that sometimes they can't necessarily be with their loved one, or that they won't remember the most important information to share, or they won't be prepared. So the importance of having this filled out in advance. We don't know we're going to the hospital in an emergency until it happens. So using a form like this and actually filling it out in case there's an emergency. So in our research that we've done, you know, about 1 in 3 people with a developmental disability will go to the emergency department at least once in the year. So if that's possible, then one in three of you will have a loved one going to the hospital, right? So having this form filled out beforehand can be really useful. So now we'll go to the form. And what you'll see in the next slide is the front page has this red section because we wanted the people at triage, everybody at that hospital to see right away a few key alerts or things they need to know. So it says, for example, issues around allergies, swallowing, issues with anesthetic in case that person has to be put under, okay? And important, crucial information about that care, about how that person makes decisions, about how they act if they're scared or in pain, and it's all right in the front. And then there's additional information about who key people are and also how healthcare decisions get made. So that's the front page of the tool. And then the second page of the tool, that really is just 2 pages, looks more at if the person's in hospital, how do they communicate and what kind of help do they need from the people in the hospital to support their communication and also to help them feel less stressed out over any kind of invasive medical procedures. So again, it's a quick form. It's the kind of thing to really, even though it's scary and none of us want to think about it, to think about it in case the person you love has to go to the hospital, to have that information written out clearly and be available. And another really nice suggestion, there's a little video that kind of goes with this form. It's in French, it's in English. But one suggestion with the video is you can even put it in like a laminated, I'm not saying a laminate, is that the right word? Like, because sometimes they don't like when you bring things in. They say, well, don't bring stuff in because we're worried about all the stuff that people will touch in the hospital. So bring it in one of those plastic casings so they can just wipe it down if they needed to. But the information is right there. Again, I think that it's the important information. Remember, I talked about the Coles notes and Romeo and Juliet. This is the version that the emergency departments want to see because it's got the information up front that's most important to them when the person walks into the hospital. So yes, it is unfortunate, Abigail, that people don't have tools like this. It's a terrifying experience when it's not COVID. It's even scarier when it is. So anything we can do, I think, to help people feel a bit more prepared if that happens can help facilitate things in that visit. So yeah, or a large Ziploc bag. Thank you. Very good point. If you can't find a laminate or remember the word laminate, Ziplocs work well too. And also there's a lot of helpful things you can bring besides that form. So bringing your medications that you would need because nobody's going to give you your regular medications while you're waiting. If you have food snacks that you need, if you need an activity to do, not only the iPad, tablet, whatever, but the power battery plug-in that you're going to need because you'll be there for a while. So certain kinds of information and things you can bring to make these long visits go better, especially if you can't go in with the person. And also this form, plus maybe a note from the doctor, can help illustrate immediately why you do need to be there with the person. And sometimes what happens in some hospitals is immediately they may not let you in, but then they do. Or they let you in at the beginning, but then they ask you to leave, but then they ask you to come back. So don't freak out completely if for a short time you can't necessarily be there. Most important is to have that vital information to show why you need to be there, and then hopefully it can happen. Calling before is also very helpful to give people a bit of a heads up and explaining why it needs to happen in addition to a note from the doctor. So I think I have one more slide. Yeah, so a few tips. I think we feel helpless during COVID. I do sometimes. I actually wrote a piece about this very thing, about my own absolute terror, fear that if my sister had to go to the hospital and I couldn't be there with her, how difficult that would be. So I wrote about that. I'm happy to share that with people tomorrow. But to help us feel a little bit less helpless, to remember that there are always things we can do, I think is really important. So the first point here is that you know your loved one best. So you'll remember last week we spoke about knowing kind of your baseline, knowing their baseline, how things are on a regular day, what temperature they usually have, right? And I said, well, there's no fever right now. Well, my loved one never goes above 36 point whatever. You know, this little bit of a fever is very serious for them. You know that information, other people don't, okay? So have that information up front. Remember how much you understand about your loved one. Whenever you can, try to have these kinds of conversations with your loved one so it's not so sudden and stressful when it is more of an emergency. Help them be more able to advocate for their own healthcare by getting more accustomed to having these conversations. And there's resources to help have the conversations, especially for people who can't use words as easily. The resources in our Family Matters Toolkit should help, so have some fun exploring it on the website. Thinking about in your own family, if there was an emergency, what would you do? So would one of you go? Would one of you stay home? Are there phone numbers and things you need to have? Is one of you better at handling emergencies? So some of us are really good at cooking and some of us are really good at problem solving, but then we completely shut down when it comes to being in an emergency department. One of us might be better than someone else. So kind of knowing that and picking out who would do what is a good plan to have. And also someone else in the family might need to go to the hospital for an emergency. So you can plan for that as well. Keep in mind, we all want to feel when we go to the doctors, what makes it a good visit, and I'm sure this came out in the comments earlier, is that sense of being listened to, being heard, and also being seen. So anything we can do to facilitate making healthcare interactions feel like your loved one is being listened to and your loved one is being seen, and also your concerns are being heard and you are being seen is really important. And the little plug I'll just add to that is that when it's virtual, the care that you're getting, and it's not in person, it can be really useful to be using a camera and having some kind of visual interaction. So you're not just being heard, but you are being seen, and you can also see the healthcare provider. That can be really important for our loved ones. And it does not happen enough. And finally, it's really important when you're going to use emergency healthcare, regular healthcare, whatever, know what you need and know what you don't. So you do need to ask for help to make these things go well. If you've got to run right now and all you can think about is getting your loved one to the emergency department, somebody else has to deal with things at home, right? Or there's certain things you need dropped off in the parking lot while you're in the emerge. Or you're going to sit in your car and wait in the emerge right now, but there's some other things. Someone could come and bring you some food, or someone else could sit here. Like, know what is going to be helpful. Know who those people are that you can ask to do things that are helpful. And if your brain is shut down so much that you can't think of what is helpful, it's also okay to know what is not helpful and to feel bold enough to say, you know what, that advice doesn't help me right now. You know, you telling me it's going to be okay, are you relating it to your own problems that you have? That actually doesn't do it for me. I just need someone to sit with me very quietly right now, or I need someone who can take directions. You know, so knowing what it is that doesn't help is just as valuable, I think, sometimes as knowing what is helpful.
I think we said this in a lot of different ways today. I think, you know, that last form, the COVID transfer tool, for me, that's sort of, even thinking about completing it with my son was scary. Like, it's just my worst fear is that I wouldn't be able to be there to support. But it also highlighted for me that one day, regrettably, I won't always be here. So it also got me thinking about just, you know, increasing this number of people that can support my loved one and it not just fall to me, but also just how much information is stored in my mind that having it, taking the time to put some of this down on paper and sharing it with a wider circle is in itself, even if we don't need to use this COVID transfer tool, it highlighted for me how much I know that maybe others don't know. And I heard a really good analogy. It was probably Yona that said almost having a kit, like if you were expecting a baby, you'd have like the suitcase packed by the door ready to go, you know, have that extra, you know, charger, phone charger, and the soothing, you know, what's soothing and books, and this tool in a sleeve, this COVID transfer tool in a sleeve, ready to go. So just instead of my mind being whirling about, oh my gosh, what if that happens? It's like, I can breathe into it and say, okay, if that worst case scenario does happen, I've already prepared. I've prepared it to the best that I can. And in some ways, I've also started the conversation to prepare my loved one. And again, I think just this is such a wonderful quote. And I think we've covered it already, that empowering our loved one, you know, that feeling of, I guess I think about it, I don't even know how to put it into words exactly, but I think it must be really reassuring to my loved one to also know that their voice is really important, not only to me, but to others. And this is an opportunity for me to say, you know, I really want to capture what you want me to say, not just, you know, my opinion. So it just includes my loved one to the degree that they're able to communicate, to have a written record so that they're an integral part of their own healthcare. I think that's just really what this quote means to me.
Thanks so much, Lee, for that. Thank you, Irfan and Yona as well. for sharing all this really amazing information. And thank you also to everybody who's been sharing really great things around what's worked for you in the chat. So just before we close today, we were wondering if people want to think about sort of what's one thing you're going to do to support healthcare communication for your loved one. And just to think about it, you can write it down if you want, you can put it in the chat, you can just think about it in your head, and that can just be as simple as starting a conversation about healthcare with your loved one. Going to that Family Matters Toolkit website and taking a look at some of the forms, maybe filling out one of the forms presented today, or maybe modifying or updating a form or a tool you're already using to support healthcare communication with your loved one. Or it might even be trying one of the really awesome suggestions that all of you have shared today around making those healthcare encounters better. So just take a moment maybe and think through that. And if you want, you can put it in the chat, or you can write it down, or just something to reflect on.
I was just wondering, Joanna, while people are doing that, Irfan, because you've worked so closely with self-advocates, can you just maybe share a couple of things that they told you about how these forms, impacted them? I think that would be really helpful.
For sure. I think one of the biggest things that they relayed was how it helped them feel prepared and made sure that, like one of them, I can remember very clearly, she mentioned that, I am not the best with my words, and especially in difficult situations, I won't always say the right things. But if I've taken some time to write down what I need to say and what it is that I want to do, what it is I want to tell my doctor, then I won't forget, and I'll see those things, and I'll have those right words ready to prompt me to say the things that I need to say during that visit. So that's something that I remember very distinctly, one of our self-advocates sharing. And then the other self-advocate said, I generally have my mom at most of my visits, so I don't use this tool a lot, but I can see how for somebody who doesn't have that support person, having this ahead of time can go with them to the visit, especially if you struggle with communication. That written form and the doctor reading that form really quickly can convey a lot of that information when somebody struggles to get their words out. So those are some of the things that self-advocates have said. Something else I'll quickly share as well is that it really helps with that nervous feeling. A lot of people are scared of their doctors and are anxious about the whole healthcare experience. So doing that prep work ahead of time makes sure that it helps with that anxiety around the healthcare experience and getting things, getting what needs to be done.
I noticed an interesting comment in the chat box about how it might be good for me and my husband to fill this out, but it would probably make my daughter very anxious and confused because she's not sick right now, so why would she be filling this out? And the two things I want to say, good point, is you know your loved one best. So you know how to fill out this form and when to fill out this form and which part of the form to use better than anyone. And for some people, it might be very confusing. For some people, one way to think about it, if you did want to introduce it at all, is, probably we're all going to be okay. But when everyone talks about COVID, if people do get sick and we do go to the hospital, it's probably good for us to all have our information ready. So how about we fill out one form for me, one form for you, one form for your sister, right? Because it's the same questions. And maybe you're filling it out together, right? So they each have a form. So if anyone has an emergency, here's the information. When we started making forms like this for emergency departments before COVID, the most common thing we heard when we went to the emergency departments to talk about it is, this would be great for like older people, or this would be really good for people who don't speak English very well, or this would be very good for, right? So it's not just for someone with a developmental disability. That's who we had in mind, but it's something that it's an activity preparing for our healthcare, and knowing what we want to say at an appointment or knowing what information we want people to have about us is something that we all can do. And that can be a helpful message.
I was just going to say that was what I said. That was my opportunity to say, as an aging person, I actually like taking someone to my healthcare visits with me now to take notes. So I just normalized it that we all need, it's interdependence, not independence. That was how I also gave context to why we're doing these forms. This is helpful for me too, because,
Right.
you know, we all need someone when we're really scared and anxious.
Yeah, and it may be for a certain kind of appointment that's the same old appointment every year. You don't need the same support, but if it's like a new diagnosis or a new problem or confusing information, it's more important to have someone there. One thing to keep in mind during COVID is that it's actually easier in some ways with virtual care to have more people at a visit than it was before COVID, right? So it's a real pain in the butt to get like the other healthcare provider and the person from the school or the residents, and you and your loved one and your sibling who moved away, you know, but actually maybe everyone could join a virtual visit together, right? So even if you can't go in the room, say with your loved one, maybe just making sure you've set up, for example, that you're on the phone can be really helpful. And we do have a link. I don't know if we showed the video last week, but we have an example of showing how a virtual healthcare visit might go with video. And sometimes it can be useful to watch something like that if people have never been involved in a visit where they're not actually at the doctor's or where someone from the house isn't at the doctor's.
Wonderful. Thanks, everyone. Thanks to our presenters today. And thank you all for joining us again. We hope that you found today interesting and engaging. And next week, we'll be talking about mental health interventions. Okay, wonderful. Thanks, everyone. Have a great rest of the week. We'll see you next week.